Dr. Andrews' patient is in the delivery room to deliver her second child. The infant is born in a precipitous delivery. Dr. Andrews told you that the fetus is at 29 weeks gestational age. When delivered, the baby boy is flaccid and is not breathing or crying. 1. Medical conditions that increase the risk of complications in a preterm infant include all of the following except A. Thick skin, B. Lower amount of subcutaneous fat, C. Non-compliant lungs, D. Limited glucose reserves. Correct answer, A. Thick skin. The preterm newborn has very thin skin, which increases the risk for hypothermia. The preterm infant also has underdeveloped body systems, leading to risk of infection, bleeding, hypotension, and other issues. Warm, dry, stimulate, and position the infant. You know that the preterm infant is at high risk for hypothermia and that the routine methods of warming may not be sufficient. 2. Other methods to provide warmth to the preterm infant may include A. Thermal mattress, B. Polyethylene plastic wrap, C. Radiant warmer, D. All of the above. Correct answer, D. All of the methods can be used to provide warmth to the preterm infant. You place the infant on a thermal mattress under a radiant warmer. He is still not breathing, but you also tape for a heart rate and know that the heart rate is 84 beats per minute. 3. You know that a normal heart rate for a newly born baby is A. 60 beats per minute, B. 72 beats per minute, C. 80 beats per minute, D. At least 100 beats per minute. Correct answer, D. At least 100 beats per minute. The infant begins to have some gasping respirations. Another team member applies a pulse oximeter and a cardiac monitor. You reposition the infant and begin positive pressure ventilation using a T-piece resuscitator. 4. When providing PPV to the preterm infant, you know that the provider should deliver breaths with the initial pressure of A. 5 to 10 centimeters water, B. 10 to 15 centimeters water, C. 15 to 20 centimeters water, D. 20 to 25 centimeters water. Correct answer, D. 20 to 25 centimeters water. The lungs of a preterm infant are very sensitive to pressure. So, the team should start with the lowest pressure possible and should not exceed a pressure of 40 centimeters water. Many sources recommend limiting the pressure to no more than 30 centimeters water when using a face mask for ventilation. You provide PPV to the term infant at 40 to 60 breaths per minute with an oxygen concentration of 21%. As you provide PPV for 15 seconds, you instruct the team to do a quick assessment of the newborn. 5. The most significant finding of successful resuscitation of this infant is A. Decrease in cyanosis, B. Increase in heart rate, C. Increase in oxygen saturation, D. Increase in the movements of extremities. Correct answer, B. An increase in the heart rate after 15 seconds of PPV is a good indication of the success of lung inflation. The team member during the assessment announces that the chest is rising and the heart rate has decreased to 56 beats per minute. As a resuscitation team leader, you go through the Mr. SOPA interventions to improve ventilation and increase the heart rate. After an additional 15 seconds of PPV, the team reports that the infant's heart rate has not changed. 6. You know that the next intervention you must do is A. Applying a laryngeal mask, B. Increase the respiratory rate, C. Intubate the baby, D. Increase the PIP on the T-piece. Correct answer, C. Intubate the baby. The fact that the heart rate has not increased is an ominous sign and indicates that the ventilation and oxygenation are not adequate. The infant is quickly moving toward full cardiac arrest. As you prepare for endotracheal tube insertion, you instruct the team to begin chest compressions. 7. The correct rate for chest compressions for an infant is A. 60 per minute, B. 90 per minute, C. 100 per minute, D. 120 per minute. Correct answer, B. Compression should be started at 90 compressions per minute. As chest compressions and PPV continue, you intubate the infant and order the oxygen concentration to be increased to 100%. 8. After intubation, chest compression to ventilation ratio should be A. 2:1, B. 3:1, C. 4:1, D. 5:1. Correct answer, B. 3:1. The team must avoid giving chest compressions at the same time a PPV breath is delivered. It is helpful for the team member to do compressions by counting 1 and 2 and 3 and… At that point, the compressor stops doing compressions and says breathe. At that cue, the team member handling the ventilation should deliver 1 breath. The team is providing PPV with visible chest rise in coordination with the chest compressions. Oxygen saturation on the pulse oximeter shows an oxygen saturation of 60%. 9. The team leader should consider administration of which medication through the ET tube. A. Atropine, B. Epinephrine, C. Surfactant, D. Naloxone. Correct answer, C. The team must consider giving surfactant because the preterm infant's lungs are underdeveloped. At the end of 60 seconds, the team stops CPR and looks at the ECG monitor to determine the heart rate. The heart rate on the monitor is still 56 beats per minute. 10. At this point, the team should A. Stop compressions, B. Resume coordinated compressions and PPV, C. Continue PPV only, D. Do a full assessment of the infant. Correct answer, B. Resume coordinated compressions and PPV. This is only the first assessment since starting compressions, so lack of increase in heart rate should indicate that CPR must continue. After another 60 seconds of chest compressions, the team stops for a quick reassessment of the heart rate. The team notes that the infant's heart rate is now 80 beats per minute and the pulse oximeter shows 96% oxygen saturation. 11. The best intervention now is to A. Stop compressions and increase PPV rate to 40 to 60 per minute, B. Stop compressions and PPV, C. Increase compression rate and continue PPV, D. Stop all interventions. Correct answer, A. Once the heart rate is greater than 60 per minute, the team should stop compressions and increase the PPV rate to 40 to 60 per minute. Although the infant is not stable, respiratory intervention should be sufficient to maintain oxygen delivery to the organs. 12. At this point, the team should also A. Increase the oxygen concentration, B. Maintain the oxygen concentration at 100%, C. Discontinue the pulse oximetry, D. Decrease the oxygen concentration. Correct answer, D. The preterm infant is at risk for reperfusion injuries since mechanisms that protect their cells from oxygen-associated injuries are underdeveloped. Oxygen concentration should be titrated to keep the infant's oxygen saturation between 85 and 95%. The team continues to monitor the infant and provide PPV until the heart rate is greater than 100 per minute. At that time, the team should begin post-resuscitation care.